Saw 3 different spine surgeons. They all wanted to do fusions on your neck, but you didn't want a fusion, did you?
No, sir. Did not.
Why not?
Well, I've just watched you do a couple of them, and I'm like, yeah, that's not for me. Very invasive, forceps to pry your neck open and cut you all the way down to the vertebrae. Then they insert titanium and screw it into your vertebrae, and it's like, so I just thought of the closing of my neck and things and swallowing difficulties, and it seems to create problems for other discs, and it just didn't seem like the solution for me.
That's right. It's actually, you're correct. The endoscopic surgery is far better than a fusion, and you figured that out, and that's why you had it done yesterday.
Absolutely.
All right, Dr. Deuk Laser here, and it is now November 24th, 2021. I have one of my patients who just had a cervical Deuk Laser Disc Repair for 3 herniated, degenerated discs in his neck, and basically you were going paralyzed in your right arm.
Right.
And when did all that start?
Back in April. I lifted some bags and threw them over my shoulder, and a little bit too much weight. Brain's like, yeah, you can do that, and body's like, what are you doing? After 2 or 3 weeks, I started noticing tingling in my hand, and then gradually just started losing all function of my hand.
Yeah.
So, and immediately yesterday, I could not do that.
And now you can.
I couldn't touch my finger at all, and I can almost touch the second one, see?
Yeah.
Couldn't do that at all.
So basically, he came in, he was going paralyzed, and just to show you, yesterday when I examined his hand, he literally couldn't do anything. It was like this.
Yeah.
And now today he's moving it. Why did you lose all the muscle? Why did you lose all the strength and movement? Because he had 3 herniated discs in his neck. They were pushing on the nerves, causing nerve damage, keeping his arm from working. And now here you are, less than 24 hours later.
Right.
You've already getting movement back in your hand.
Yeah.
And you said you were feeling more feeling back in here. Tell us about that.
I just felt like I had a glove from my elbow down to my hand. A glove being like something like steel that was preventing me from. I'd look at my hand, try to move it, it just wouldn't move.
Yeah.
So I still feel it a little bit, but not as bad as it was. And like I said, that this range of motion, I couldn't do the typing thing.
So you happy?
Yeah, I'm actually excited. Hopefully I'll start getting back to normal here. So.
Now, before you came to me and had your laser surgery, let's see the incision here. Can you show everybody that?
Yeah, can you see it?
Yeah. So 3 herniated discs were fixed, 1 4mm incision endoscopically, only at the Deuk Spine Institute.
Yeah.
Now, you were offered other surgeries before you came to me,
Yeah,
right?
Full,
by other
full
surgeons.
fusion. Yeah.
Fusions.
2 orthopedic and a neurosurgeon want to do a fusion surgery.
Any swallowing problems?
No, just a little where they intubated. It's a little, sore, but that's normal, I think. I don't see that.
With fusion, people have trouble swallowing and swelling in their esophagus for weeks, and they can't swallow normally, but not with laser surgery. All right, anything else you want to say to your audience before we wrap up your story?
No, I'm just quite happy that I got it done, and I'm looking forward to healing.
All right, congratulations.
Thank you.
All right.